Midterm Progress on Implementing Thailand's National Strategic Plan on Antimicrobial Resistance 2017 to 2021. Antimicrobial resistance, AMR, poses a serious threat both to the lives of Thai people and to the economy of Thailand. To resolve this problem, in 2016, the Cabinet approved the National Strategic Plan on Antimicrobial Resistance, or AMR, 2017 to 2021, to be the national roadmap for action, with an emphasis on intersectoral collaboration under the One Health approach. The National Strategic Plan on AMR consists of 6 strategies that aim to achieve 5 goals: to reduce AMR morbidity, to reduce antimicrobial consumption in humans and in animals, to increase public knowledge on AMR and on the appropriate use of antibiotics, and lastly, to improve capacity of the national AMR management system. The National Strategic Plan for AMR is overseen by the National Policy Committee on AMR, which is chaired by the Deputy Prime Minister. The committee and its 5 subcommittees provide guidance on strategic directions and facilitate collaboration across sectors in order to achieve the national goals. To monitor the success of the National Strategic Plan on AMR, the National Policy Committee on AMR has developed monitoring and evaluation systems that use data from 2017 as a baseline to assess progress towards national goals. The baseline data shows that the consumption of human antimicrobials in Thailand accounts for 74 DDD per 1,000 inhabitants per day, and the consumption of animal antimicrobials in Thailand is equal to 560 milligrams per PCU Thailand. If the National Strategic Plan on AMR is implemented successfully in 2021, these figures should decrease by 20% and 30% respectively. With respect to public knowledge on AMR and awareness of appropriate use of antibiotics, it was found that only 3% of Thai people have correct basic knowledge. If the National Strategic Plan is successful in 2021, knowledge of Thai people on this matter should increase by 20%. In addition, an assessment of the capacity of Thailand's AMR management system, facilitated by the World Health Organization, indicated that the national capacity to address AMR is at the average level. If the implementation of the National Strategic Plan is successful, the capacity of the system should hit the level of good. The monitoring system for AMR morbidity in hospitals is currently still being further developed. To achieve these 5 goals, all relevant agencies and partners across sectors have carried out their work under the 6 strategies, and the progress can be summarized as follows. Strategy 1: AMR surveillance under the One Health approach. In the past, Thailand monitored trends of antimicrobial resistance by focusing on hospital settings, and the overall trends were reported at the national level. After implementing the National Strategic Plan on AMR, 3 areas have improved significantly. First, the capacity of the national AMR surveillance system in humans has been uplifted. Specifically, it can differentiate and compare the AMR rates and patterns across individual health district areas. This enables local health professionals to plan and address their AMR situation appropriately. Second, the implementation of the WHO Global AMR Surveillance System enables us to identify patients who are affected by resistant bacteria and alert us to evolving trends of AMR in hospitals and communities in a timely manner. Third, there is now an exchange of AMR data among the human, animal, food, and environment sectors, and the development of integrated report on AMR. Additionally, there is an initiative to enhance the capacity of the AMR surveillance network under the One Health approach. Strategy 2: Regulation of antimicrobial distribution. Prior to the National Strategic Plan on AMR, there were limitations on issuing regulations to control antimicrobial distribution. After implementing the National Strategic Plan on AMR, there is progress on enhancing regulations for the reclassification of antimicrobial agents. For example, no antibiotics in any form are now available over the counter without being dispensed by pharmacists. Important antibiotics such as anti-tuberculosis drugs and antibiotics that have to be given by injection must be prescribed by a doctor. For animals, there is a regulation to prohibit the use of antimicrobials as a growth promoter, and many important antimicrobials need to be prescribed by veterinarians. In addition, the Thailand Surveillance of Antimicrobial Consumption System has been developed at national level to monitor antimicrobial consumption in humans and animals. Strategy 3: Infection prevention and control and antimicrobial stewardship in humans. Before the National Strategic Plan on AMR, policy actions to tackle AMR problems were generally focused on the appropriate use of antibiotics for common diseases that are normally managed in the outpatient department or at the community level. However, it was increasingly recognized that AMR was becoming a very serious problem in hospital inpatients. Thus, under the National Strategic Plan on AMR, an integrated AMR management in hospital framework, otherwise known as IAM, has been developed. The aim is to apply this framework in both public and private hospitals with the intention of reducing AMR-related morbidity and mortality. Strategy 4. Antimicrobial resistance prevention and control and antimicrobial stewardship in agriculture and animals. This strategy covers food-producing animals, agriculture, and companion animals. It is implemented in conjunction with Strategy 1 in the context of AMR surveillance under the One Health approach, and with Strategy 2 for the regulation of antimicrobial distribution for both animal and agricultural use. In addition, a public-private partnership is operated that supports farmers to reduce antimicrobial use and to ensure the reduction of unnecessary antimicrobial use. There is also a recent initiative called Raised Without Antibiotics, or RWA, that has been piloted in pig farms. This initiative introduces a new choice of meat products for consumers. Strategy 5. Public knowledge on antimicrobial resistance and awareness of appropriate use of antimicrobials. In the past, despite continuous awareness campaigns, public knowledge about AMR has remained limited due to the lack of integrated actions among the various agencies responsible for promoting public awareness on this important issue. The implementation of the National Strategic Plan on AMR enables relevant partners to develop work and communication plans that are synchronized in a systematic way. Moreover, a curriculum has been developed for village health volunteers to strengthen their capacity to educate the public about AMR and the appropriate use of antimicrobials. Strategy 6. Government mechanisms to move antimicrobial resistance policy and actions forward in a sustainable manner. Under this strategy, AMR has been elevated to become a policy issue at the political level. The government now strongly emphasizes the importance of AMR and commitment to collaborate with the global community. The government has translated AMR policy into actions via the National Policy Committee on Antimicrobial Resistance. During the last 2 years, the meetings of this committee have yielded a total of 26 resolutions that relevant agencies need to implement to achieve national goals. Furthermore, under this strategy, many projects and research activities are conducted to enhance the effective implementation of the National Strategic Plan on AMR. These activities are supported by the joint program of the Royal Thai Government, World Health Organization, Country Cooperation Strategy, as well as through active collaboration with international organizations such as FAO and OIE. Just as importantly, the National Strategic Plan on AMR facilitates relevant stakeholders in Thailand to collaborate in solving AMR problems in a way that has never been seen before. This collaboration includes sectors from human health, animal health, agriculture, environment, as well as professional organizations and associations, the academic sector, civil society organizations, and the private sector, all under the One Health approach. In summary, during the first 2.5 years of the implementation of the National Strategic Plan on AMR, progress has been made in every area. However, many challenges still lie ahead. Thus, strong collaboration of all sectors under continuous political support are essential to overcoming AMR challenges.